Oh, somebody didn't want to be recorded.
Can you guys all hear me okay? I know sometimes I have trouble with my audio.
We can hear you perfectly well. Thank you, Lisa, and thank you for coming. Not that you had a choice, but
Yeah, I didn't want to get taken out of the will, so.
So you can I'm going to let you give your background and kind of why you're the authority here.
Yeah, I mean, my dad asked me kind of come on here, maybe spend about 15-20 minutes kind of talking about the work that I do. So I'm going to, of course, talk about the program that I'm working with now, different challenges that we've had, kind of the basic type of client that we will see come into our program, who's eligible for our program, and successes at the end and what we've seen from. We've been open now for a little over a year, and within that year, we've seen a little bit of success, and so I can talk about that at the end as well. So yeah, as my dad said, my name's Lisa Liles. I have about 6 years experience directly working with the homeless population in different areas like San Francisco County, San Diego County, and right now I'm in Santa Clara County. Within that work, I've been in a couple different settings. I've been able to see different challenges that homeless individuals face, whether it's I'm working in a drop-in center or shelter services, a crisis house as an alternative to hospitalization, or at one point too, I was working in the jail helping with women re-entering society and trying to really get connected to housing and supportive services coming out of being incarcerated. So my program now, I'm in Santa Clara County. It's called, the agency I'm with is Home First Services of Santa Clara County. It's kind of the leading provider for shelter services in the area. They have large shelters that maybe have 200 beds available for people, and more in a bunk bed setting. And then we also have the tiny homes. And I'm not sure how many of you guys have heard of the tiny homes, but they're little individual units for residents to live in. And so the one that I'm at is based off those tiny homes. It's called emergency interim housing. And like my dad said, we have about 80 units that are available. These units come, it depends who can come into the program. We have beds available for county referrals, so specifically for people coming out of the county hotel programs, because I know they're starting to shut those down. And we also have beds for rapid rehousing, specifically people who have housing vouchers or are actively working with somebody to get housed in 60 days. We have shelter beds that are coming in from other shelters, but unfortunately their time ran out, so they're coming to our site. And then within our own agency, we also have beds available for people at our other programs who need housing for the night. And so it's best that when I talk about our program to kind of talk about the models that we use. And so with our agency and our housing complex, we go by the housing first model and the harm reduction model. So the housing first model, I'm not sure if you guys have heard of these type of models either. It basically says that anyone can get housed. But to get housed, there shouldn't be any barriers in place. There shouldn't be any rules or regulations in place. And when someone is able to get housed, then they're better able to work on their different needs. So it's hard to get a job. It's hard to even get to your doctor's appointments. It's hard to apply for benefits, to increase your finances. It's hard to work on your substance or alcohol use if you don't have a stable living environment. So part of our program is that we're a very low barrier. There aren't any curfews you have to follow. There aren't really that many guidelines you have to follow either, aside from, safety stuff like not having weapons or firearms in possession. But it's a very, very low barrier program because we believe that anyone can get housed and anyone can get into permanent housing. They just need to have that stable environment first. And then our harm reduction model is based on kind of the opposite of when you think of an abstinence only model. So our clients are able to use and have substances in their possession. They're not able to use on site, but they can have them in their possession. And the harm reduction model really just talks about being there for somebody for when they're ready to start their recovery or when they're ready to start working on their sobriety. But in that meantime, making sure that they're using safely. So whether that's, connecting to resources like our needle exchange program, or whether that's having first aid supplies on demand, or making sure that they're using in safe areas around safe people. It's really coming with somebody, not in a shameful way or making them feel guilty for their use, but really about the relationship. And that way, when they are ready, then they know that they can turn to us and they can talk with us about the next steps for their recovery. And so those are our two models that we use, the housing first model and the housing and the harm reduction model. And so back to our program though, a little bit. So our site, we have 80 units. Each unit has its own bathroom, has its own shower. It's about, I'd say like 10 by 10. We also have ADA units specifically for people who need access for that. And yeah, different services that we have on site. We have case management. So we have case managers there to help people get connected with permanent housing or maintain their doctor's appointments or get connected with whatever it is that they need, basically. Which is funny though, because not a lot of people meet with case managers, but we have them on site that they're supposed to be meeting bi-weekly. Aside from that, I'm there as well. I'm the clinician on site. So we have individual and group therapy that we're able to offer people. We have substance and alcohol groups, women empowerment groups, different workshops. Every now and again, we have nurses from the local Valley Medical Hospital come by and just see if there's anything anyone needs. That's kind of the basic of our services that we provide there. So what do our typical clients look like though? I would say that most of our clients are in the elder population, so roughly 60 to 70 years old. These people have been chronically homeless, so homeless for maybe 20 plus years. And a lot of times they get into this program because they were in the hospital for some reason, and then from the hospital they get referred to our program by the county. And so a lot of these people, this is their first time actually being off of the street. This is their first time actually having somewhat of a stable living environment, somewhat of a home that they can go to each day. And it is pretty shocking. And we actually have a lot of people that living indoors is actually too uncomfortable for them. So they exit themselves back onto the street because just being indoors is too different and it's too hard to adjust when they have been living on the street for so long. And a lot of times too, with the type of population that we get, type of clients that we do see a lot in alcohol use and a lot of people who are severely mentally ill, whether it's depression, active psychosis that they're experiencing, bipolar related disorder. We get a large mix. But of course, if you've been chronically homeless for 20 plus years, you are going to develop some of these mental health needs. And you are going to develop some substance and alcohol use just to survive each day and just to kind of make it through each day. And so we see a lot of substance and alcohol use. We see a lot of mental health concerns. And we see a lot of people who lack social support and community support. So a lot of people who aren't connected to anything in the community. Whether that's church organizations or even a medical provider or social support groups. So a lot of these people, they're alone. They don't have anyone else that they can turn to. Maybe they do have family, but unfortunately, like my dad said earlier, the relationship isn't necessarily something that they can really lean on and something that they can really gain support from. And then typically too, what we see a large number of are people who are medically vulnerable. So that happens to be right now the case at my program specifically, maybe because it is 60 to 70 years old that we see that a lot of people experience a lot of medical issues. I have a lot of clients that have cancer and are going through radiation or chemotherapy, dialysis and going to dialysis 3 to 5 times a week, or having ongoing doctor's appointments every single week that they have to go to. And this unfortunately leads to some of the challenges that we see at our site. because since the homeless population is also medically vulnerable, we do have a high utilization of emergency services. So we do see, unfortunately have to call 911 quite a bit to kind of help people when they might be experiencing something really concerning or severe that's going on. So that's always an ongoing challenge with our site, is just how do we support people when they have their own living environment, when we can't monitor them because we have to respect their privacy. So we can't just go knock on their door all the time and check on them when they're supposed to be living independently, but maybe they've been having, 5 strokes within the past year. So how do we make sure they're okay? So that's a huge challenge that we face, is just the medical needs of the population that we see, because shelter services are not set up to help for medical needs. And that's probably an ongoing challenge that we'll see. And unfortunately, we're very familiar with our ambulance and fire department staff. So they're very familiar with us as well. Other challenges are, because we are a harm reduction model, though, of course, that brings the challenges of substance use that's on site. Although that's one of our guidelines that we don't allow. And one of the things that if we do see any use on site, they unfortunately get terminated from the program. But again, we don't monitor people, and we try to help people gain their independence while having this small moment of stability. And so substance use is an ongoing issue that we have on site, and a challenge that we see. So we're not sure yet on how to really handle that, since we do have to abide by the harm reduction model that our agency follows. And then, of course, housing availability, because our site isn't supposed to be permanent, our site isn't supposed to be long-term, and we're supposed to get every resident that comes to our site enrolled into permanent housing. But housing availability in Santa Clara County is very limited, and especially during COVID, it's very limited with services that are open and services that are available. And so some of these people, although we're supposed to be a 60-day program later on, some people have been in our site for a year, maybe over a year. I think the first client I have was from early September. And so it's kind of what's the next step with this? And that's something that I know our agency in the county is really trying to think about, because there aren't a lot of housing resources. And now we have 80 people in our program that need to get into permanent housing before the time runs out. And so that's an ongoing challenge that we will see, and that we're not sure what's going to happen at the end of COVID. How many of the people in the program will be able to get into permanent housing? And although my site has 80 beds, our other site just down the street, they have about 120 beds, and they also take couples. And then we have 2 other sites that each have 40 beds. So it's quite a lot of people that need to get into permanent housing, that there just isn't a lot of services available and a lot of housing options available. So that's always going to be an ongoing issue that we'll see. I mean, but when I think about success rates, I've had a lot of successes for what we were expected to have. We've probably had about 130 people come through our program so far within the year. And out of the 130 people, I'd say about 20 or so actually got into permanent housing. Again, this is from rapid rehousing and them having housing vouchers, so they're able to get into permanent housing. Them maybe going into independent living facilities, or maybe they just find their own place on Craigslist for very cheap, and case managers help them figure out how to apply for those places. So I'd say for what we were anticipating, that's a large success rate, larger than what we originally thought we were going to get, just because housing is very, very limited in our area. And like my dad said, at the very beginning, a lot of these people too do have families in the area, whether it's their kids or their grandchildren, their sisters or brothers, their cousins and aunts. Most of them have been in San Jose all their life, and their families are also in San Jose. But unfortunately, a lot of times the option to live with their family isn't available because of the ongoing substance or alcohol use or mental health issues that come up. Or I see people denying to live with their family when they are offered it just because they want to be independent and they don't want to feel like a burden from their family. And so that also poses another challenge, is that there might be housing available for somebody with their family, but they're not at a place to accept that offer yet and accept that help from their family. And so they continue living at our site, searching for alternatives. But yeah, are there any questions or anything like that that I went over? I hope I didn't go over any of that too fast. I wasn't exactly sure what you guys might be interested in, or maybe not interested on what to expand on.
Lisa, this is Gary, and ironically, just last night I watched a very short little video about Finland and how it is one of the only countries in the world that's actually continued to have success even during COVID against homelessness. And it sounded very much like your program, which is housing first, that they simply said you just simply have to get them someplace because you can't expect them to progress if they don't have a place to live. It just becomes hopeless.
Yeah.
But following up on that, I'm guessing that you're following that Finnish model. Are there any homeless facilities similar to yours in Contra Costa County?
For Contra Costa County, I'm not so sure. I know that I don't believe there are any, and I don't believe that they're in the process of actively creating any right now. I know in terms of like the tiny homes, sorry, my cat. In terms of the tiny homes and our type of program, we are the first in this area. So we get a lot of visitors, whether from Alameda County. I know their mayor stopped by because Alameda County is starting to think about doing a tiny homes. In San Francisco County too, I think they just broke ground recently to create a site like ours, but I haven't heard anything about Contra Costa County starting yet that process. But I don't know if my dad would know more about that or something.
And I was just going to comment on one thing about that. A lot of people don't realize part of the reason the tiny home thing works is because they're mobile, they don't have to meet the building codes. And it turns out the building codes set minimum sizes for bedrooms and kitchens, and it's crazy. We should never have done that. The building code should keep us safe, but it shouldn't force us to spend more money than we have. And so one of the reasons a lot of your stuff is mobile is those rules don't apply because they're not buildings. And you'd think we could think out of the box a little better than that, but we can't. Sorry.
Yeah, well, we definitely have ongoing building issues and maintenance issues at our site just because we were built so quickly. Our site was in response to COVID, and so we're funded through the COVID funds that were released to the county. So because of that, they built our site in like 4 months. In 4 months, we're up and running. And I know our other site too that got built in response to COVID, and I think they built that site in about 6 months. So they put them up very, very fast, very fast. But if you're saying before about, the housing first model, and just a great opportunity and a great thing that the county was able to do just to provide this many beds, because 80 beds at our site and 120 beds at the other site that can also house couples. I mean, that's a lot of individuals that were able to get off the street and were able to kind of get in a stable environment for a little bit of time to work on permanent housing, to work on connected with a doctor for medical needs, to work on substance and alcohol use, to work on the mental health complications that come up, because if you don't have a stable environment, you can't really do any of those things because you're just trying to survive each day and not get hurt on the street or not get stopped by police on the street or not get all of your items stolen. And so although they were built very, very quickly, which we always have maintenance orders, like every day, things are falling off and walls are falling down. And yeah, plumbing and electricing, although it was built very quickly, it was a great thing that the county was able to do. And I hope they keep these sites up too, even after COVID, or after we run out of our COVID funding, I should say, that we're still able to have these sites, because yeah, to have up 300 beds within a year, I mean, that's pretty amazing. And not only beds, but individual little units, individual little studios. I mean, it's just a great thing that we're able to offer.
Thank you so much, Lisa, for this wonderful information. I have a question for you.
Mhm.
Does your organization exchange information with or work very closely with nonprofit organizations in the area? So that was one question. If you
Mhm.
work with them directly to provide services for your clients. The other part of the question is, do you exchange information to offer a better service for your clients? And that would be exchanging information with the county and the nonprofit organizations providing support.
Mhm. Yeah, that's a great question. Because we are funded through the county, we do, and our goal is to, again, get people off the street into permanent housing. That's why we were created. We do work very, very closely with the county, very close with the county officials, with the hotel programs that they have up and running, because they're trying to close them. And we do work very close with the housing of supportive, or the Department of Supportive Housing. And so that's where like rapid rehousing comes in, housing vouchers come in. I'm not sure if any of you guys are familiar with the VSPADAT or what that is, but that's kind of the like an intake or an assessment that homeless individuals can complete to see where they fall on being able to get support with housing through the county or not being able to get support with housing through the county. So we do work very, very close with the county. Aside from them, other nonprofits that we work with, I can't really answer that question. Maybe other programs work closer with other nonprofits. For us, I guess it's mainly mental health agencies like Momentum or Community Solutions that we try to get help people get connected with outpatient services. And of course, we work very closely with hospital staff. So most of the people at our program have medical social workers through Valley Medical or Kaiser. And so we work closely with those type of agencies, medical agencies, mental health agencies, and then the county specifically for housing, because that's mainly how we get people housed. Oh, I think you're muted, Frank.
There you go.
So in Alameda County, in Livermore, there's a tiny homes project called Goodness Village.
Mhm.
And in our conference, even though we're in Contra Costa County, we're able to get 2 homeless people into the first 28 units that they have in there. It's going from living on the street to a 10 by 20 space, but it has a bed, it has a kitchenette, it has a bathroom, it has a shower, it has a closet, and it's wonderful to go to like I say, 2 homeless ladies and elderly. So if you want to look it up, it's another resource. Hopefully I'd like to see Contra Costa County get involved with something like this. It's Goodness Village. You can Google it, and there's a video and everything else that goes with it. Good
I'm gonna
resource.
write it down. Goodness Village.
Yes.
Yeah, it definitely sounds very similar to what my site is like too, just because it's really is like a little studio that everybody has, finally have the privacy of their own bathroom, and we have a shared kitchen and everything. And so it's great to see that there's one in Livermore in that area.
Lisa, how much staff do you need to take care of 80 people?
So we're supposed to have at least 5 staff every shift. So we're a 24/7 facility. So we do have a day shift, swing shift, and a grave shift. During day though, there are more people because like I'm there too. So I'm there to provide support and meet with people. And the case managers are only there during the day as well. And the program managers there during the day. But I say we have about, well, and we have some part-time employees. I don't know, I'd say we have about like 30 or 40 staff at our site. And yeah, I actually think that's too many people. because-
So it's 40 people to take care of 80 people. So
Yeah.
anytime you're starting to talk about having a homeless complex, you need a lot of resources, a lot of staff to
Mhm.
take care of them.
Right,
And
and
that's
it's the
not-
20, it's the
Mhm.
24/7 that really eats up the thing. 'Cause
Yeah.
at any given point in time, you're greatly outnumbered, but the problem is it's a 24/7.
Yeah, well, and we have security too. And so all of our, I know I've worked with some programs that there aren't any gates or aren't any security. This site and all of our agencies, shelters happen to have security and be gated communities just because for safety measures to monitor who's coming in and out. If there are any weapons that come up or are any, violence that comes out between residents, it's good to have security there as extra. And we used to have 4 security to every shift as well. So aside from the 5 staff members, we'd have 4 security. So quite a bit of staff. But again, I feel like 5 staff members every shift is a little too much because most people stay to themselves. I mean, most people maybe come into the kitchen, get some food, and then they stay in their room or they go into the dog park that we have on
Do they have a
site.
kitchen? That's-
Yeah.
So
Yeah,
is
we
it a
have
communal kitchen, or how does that work? Like, do they cook their own meals or?
Yeah, it's a communal kitchen. And so we have like 3 really big refrigerators that people can put their groceries in, and 1 community refrigerator. We have a couple of stoves, we have a couple of sinks. It's a pretty large kitchen that we have. And so people can make their own food and cook their own food. But right now, because of COVID, and we're trying to avoid people going too much out in the community to reduce the risk of them getting infected. We do provide breakfast, lunch, and dinner. So we do also have that come every day, but I'm not sure how much longer we'll be doing that. Because again, we're trying to help people become independent, and part of that is also helping people learn how to grocery shop on their own, how to cook on their own, and get their daily meals on their own. So right now we do provide it. I'm not sure how much longer that will be happening.
Lisa, what's the area around your facility like, and what do you do with the, unhoused that are knocking at your doors or come, to be in the area in hopes or whatever?
Yeah, I mean, that was a huge concern when we were created, is the neighborhood. Before we opened up, we held a lot of meetings with neighborhood residents and community members just to educate them what the program was going to be like and talk about any concerns. And we got a lot of blowback. So a lot of people are really concerned about having the shelter in the area, thinking that it would create more people around them, more trash that's around, or shopping carts, or cars that are abandoned, and homeless individuals and encampments starting up. But the area that we're in is very isolated. So we're in South San Jose, at the very end of South San Jose. So we actually don't get a lot of people randomly coming by. We don't really have anyone knocking on our door asking to stay there. We don't have any encampments that are, well, there's one encampment, but that was there before we were there. But we don't have anything new that's come up from our site being there. So that's the experience with my site. Is other shelters within Santa Clara County, it's definitely not like that, and they have to do abatements frequently on the street because so many people come by trying to get shelter. And I'm not sure how they handle that. I think they mostly just do it through abatements, unfortunately, since the neighborhood makes a lot of complaints to the county about it. But we're very lucky that we're kind of in a very secluded, out of the neighborhood area, so no one really sees us that much. I think someone had a question in here too. a donation towards the program. So we can't, so for donations, just like, and this is with all agencies I've worked with that I've learned, is that specific programs can't take donations. It has to go to a general agency donation and then they disperse the funds. But if anyone wants to donate to the program, you know, you're more than welcome to. All you have to do is go to our website at homefirstSantaClaraCounty.org, and you can always help out if you'd like to. But I would say for donations too, I noticed that there's more of a need for materials rather than cash donations, like socks or notebooks or umbrellas, kind of basic need things that we don't really think about. Even plungers. Right now we're on a plunger shortage for everyone in their bathroom. So we need a lot of basic needs. And I think that's for all agencies can say that. We need a lot of kind of just materials. Yeah. Any other questions or comments that?
I have a comment to make. Ron Smith from St. Jerome's. We don't get a lot of homeless coming, maybe several a month. And we've never gotten any of them in a shelter. So if somebody's totally homeless and we call, there are shelters here and they're very nice and we've helped them. But they actually, we call and they can't get anyone in. They'll say, try again tomorrow, or they'll give us several other people. We go try them all and they're all sold out because of the, you know. And so we usually, sometimes we'll put people up in a motel for a night or two. We try not to make that a habit because it's so much more expensive to put people up in a motel. One family we put up for a week because we got to deal with a motel manager for the price of 3 days. She let them stay for a week and then they went on. But it's a very frustrating thing because the shelters around us in West County are they're always sold out. And there's a thing where they'll send two people, I can't remember what group it is from the county, they'll send two people to counselors to check out somebody, but the counselors have never showed. They'll say, we'll try to be there between, you know, they'll give you 6 hours or something like that, but they've never made it. So we end up just passing on it or something. So it's a very frustrating thing when we do get homeless, but we give them something. Thank you.
Lisa, I know we've hit 11:30, but I'm wondering if you can mention to them about when you're in San Francisco working with the homeless youth. Tell everybody what a traveler is.
Bob, I don't see her on. I think she got,
I think she bounced on.
yeah.
I told her 11:30, so she must have kicked off right at 11:30. But when she worked for Larkin Street Youth in San Francisco, she had an interesting story. The youth didn't want to be called homeless. They said they were travelers. Traveled to San Francisco, then they'd see a concert going on in San Diego. When she moved down to San Diego, she saw them down there at the San Diego beach. They just travel from place to place. In the year she was there, she was able to house one person in a year. And that person eventually said, no, I'm going back to the street so I can be with my boyfriend. And they were happy with the homeless life, that segment of the population. They were happy living homeless in San Francisco. But they weren't homeless, they were travelers. So I don't know what happened, but apparently she's off. And
Is she out of the will now then? Is that it?
yeah, well,
I would like to have everybody clap and thank Lisa, and Bob, please pass on to her fabulous presentation. What an inspiration to all of us. Thank you, thank you, thank you.
Thank you.
well, she's calling me right now. What's
Oh,
up?
good.
It logged her off, Claudia.
I did not.
It said it kicked her off. Oh,
Oh,
well.
no, it's okay.
It's mean Claudia.
No.
It's 11:30 anyway. We said we only go to 11:30. Maybe we'll bring you back some other day. But thank you, Lisa.
Thank you.
Thank you.
This
Thank
is
you,
a
thank you.
great
This is a great opportunity because as a council and our conference in particular,
Okay.
we don't have a lot of
Okay.
advocacy,
Okay, fine,
voice of
thank
the
you.
poor.
Everybody enjoyed you.
And this would be
Y'all
a great,
applauded for you.
if somebody in your conference wants to go to the county, the board of supervisors, or each of our cities to talk about, what we can do because of what Gary was saying, there's a lot of regulations there that they're keeping us, all of us from, building different things or having a unit to let people come in. So that's just an opportunity. I'm not gonna do it, but I just thought
I just wanted to share with you that I am one of the core members for the Racial Equity and Social Justice Office that is forming at the county level. So this is something that is very, very close to my heart, and we're working on it. And Bob, could you please let Lisa know that I would love to connect with her again to see if we can get some more information
Okay,
about their organization. Thank you so much.
And I
Thank
put
you.
the organization's website into the chat. It's homefirstSCC.org.
Well, Bob must be very proud of his daughter.
yeah, I am. I have 3 daughters. The oldest one is in charge of WIC, Women and Infant Children for Santa Barbara County, and nutritional services. The middle one's an environmental engineer trying to save the planet, and my youngest one works with the homeless. And they do that because I worked with Dow Chemical and I polluted the world, so they're trying to make up for it.
But the favorite one right now is the Santa Barbara one because that's the one who gave Bob and his wife Jane their first grandbaby.
Yeah.
Oh, I just wanted to share something. I put it in the chat. But I've been working with homeless group in Martinez, that is the Camp Hope down at the amphitheater in the Martinez Marina, run by one of my dear friends, Norley Giffner, who has formed a nonprofit. And it's a camp. They have, over the last year and a half, they've been trying to transition people into permanent housing and getting them services. But I mean, it is, anyway, you can go to YouTube and look at a video. It's called Camp Hope Martinez. And it'd be very informative. And with things stopping, they're going to, or things going to have to be moving or closing down. They're trying to look for a permanent location and transitioning into other things, but it's provided medical services. It's got a kitchen. It's got bathrooms. It's got, anyway, it's very informational if you want to look at that. So I
Thanks,
just thought I'd
Cindy.
share that.
Thank you. Thank you.
You're welcome.
Okay, thank you all for attending. And if any of you have somebody that you think that the group would be interested in, I myself, I always, especially when we met in person, it's like if we're driving all the way there, it's nice to have somebody talk for a little bit rather than just going over the district council business. So I'm very open to anybody else having suggestions on how we can spend some time at the meeting. I like it. Maybe you guys don't and just want to get the business done and move on, but whatever you guys want. This meeting's for you. It's informational for you to help you. And sometimes I know we send out a lot of emails to everybody, and sometimes emails don't always express what we want to say correctly. So it's best to say it in person and where you can go have some back and forth and understand what we're really trying to say. But thank you and keep up the good work, and see you in December. And everybody will have the report to see October 26th.
Yes, thank you. And I know we'll follow. We have a couple follow-ups. We'll get the thing on the Afghan refugees out to everybody. Bob will let Jose and Peter.
I got the names down.
Yeah,
I'll send Dropbox
group
out.
to know, and everybody else. Thank you very much. Blessings. So happy upcoming feast day of our patron saint.
Bye.
Bye.
Thanks, everyone. Thank you, Bob. Thank your daughter. That was wonderful. so encouraging to hear that all the stuff she's doing down there.
Okay.
I hope we
Thank
get
you.
it
That
up
means a
here.
lot to me.
It was
Thank
really good.